クリス先生の方からDTM&H、MTM についての話をしていただきます。So, Dr. Chris, are you ready for your presentation?
Yes. Hi, I'm ready. Good evening, konbanwa. I'm very sorry, but ego dake. My Nihongo is not skilled yet. Sumimasen. But nice to meet you, everyone. Yoroshiku onegaishimasu. And thank you for allowing me to speak this evening and introduce the Dtm&H. Can you see my screen? Okay, my PowerPoint. Is it okay? Yeah, thank you very much. Just quickly to introduce myself. My name's Chris Smith. I'm a medical doctor from the UK. I did my work in the hospitals for several years and then later trained as a general practitioner. And I had the chance to work overseas in some different contexts, in Belize as an expedition doctor, with MSF in Uganda, and in Cambodia on a quality improvement project. And only after doing all of this did I decide to do masters in public health in the London School of Hygiene and Tropical Medicine, and followed by PhD, and then becoming a staff there and doing some sexual and reproductive health research initially. And in recent years, since towards the end of 2017, I was very lucky to get a joint position between the Nagasaki University, TMGH. I'm sure you know this School of Tropical Medicine and Global Health. It's a split position with LSHTM. And one major thing I've been doing in this position is setting up a Nagasaki University Dtm&H course, which I'll talk about in a moment. But also I'm quite involved in a master's course teaching and infectious diseases research in the Philippines. And I was fortunate also to have the opportunity to go to Papua New Guinea last year with Matsui Sensei, and we both worked as consultants with the WHO or the COVID response. So in terms of my teaching activities, as I mentioned, I'm working on the 3 master's courses here in TMGH, which are taught in English language, Master of Public Health, Master of Science, and the Master of Tropical Medicine. The Master of Tropical Medicine, or MTM course, probably the most relevant for medical doctors because it's a 1-year course, so it's quite compatible with working as an MD. It can be done as a kind of split study option over 2 years or 3 years. I like to join NECA English case conference discussions on Wednesday evenings, which we sometimes combine with research meetings. And I'm involved in some PhD supervision projects in the Philippines and the DRC in Zambia. And of course, the Dtm&H course. Now, for those of you who are not aware about Dtm&H course, it's a qualification for medical doctors to teach the skills required to manage and prevent diseases, especially prevalent in tropical or developing countries where resources may be limited. This course is very old, maybe more than 100 years old, from a London school or Liverpool school, and at that time very much based on the parasites, diseases, and looking down a microscope. Over time, they've evolved. There are different courses around the world. And the one course I was very fortunate to do in East Africa. And here we are on a ward round learning about point of care ultrasound. So several courses around the world. In not so many in Asia. There's a Mahidol course and now the Nagasaki course, which is the first kind of accredited Dtm&H course in Japan. The reason for Dtm&H course may be because it's going to fill the gaps from the kind of stuff we learn and what we need to know about if we're working in Japan or UK, which is highly dominated by non-communicable diseases. And if we were to go and work in some setting like Uganda, the burden of disease is completely different and switch to infectious diseases and these so-called big three, HIV, TB, malaria, but also many different less common diseases, so-called neglected tropical diseases, which are often the parasite disease or protozoal disease. So the idea of DTM&H is to prepare doctors to work in these sort of settings, but it can also be very useful for doctors who are working in travel clinics or infectious diseases in Japan or UK, where you may be seeing travelers coming from different parts of the world. So the schedule in Nagasaki, as you may already know, the Masters of Tropical Medicine course is a one-year course, and it starts in October and through for 1 year. And it's split into 4 quarters. And the first quarter is teaching of epidemiology, statistics, global health, tropical medicine introduction, etc. And then the second quarter is time to work on a research project. And that's the same as the 4th quarter as well for research project time. And quarter 3, during this time, we integrate with the DTM&H course. So this is quite an intensive period of time of tropical medicine education. And it's 4 weeks, April before Golden Week, then the Golden Week, and then another 4 weeks of lectures and laboratory practicals and some examination. The first year we ran it, we also included 2 weeks in the Philippines as well, when it was free and easy to travel. So that was 2019, where there was no COVID at all. And then 2020, last year, we were quite disrupted with the first waves of COVID and a lot of cancellation and disruption. This year, we just finished another 3rd course, and we were disrupted, but not quite so heavily, actually. We were kind of got used to COVID and used to using Zoom. And we don't really know what's going to happen exactly next year. We hope the situation will improve. But what we will do is have the Nagasaki, DTM&H, and slightly separate the Philippines as a separate course. In that way, we can invite doctors, for example, in NEC and NICA or other place to join, because it's just a 2-week course in the Philippines. This course, Nagasaki course, is accredited by American Society of Tropical Medicine and Hygiene, so the student who graduate can sit additional exams, like the CTROP Med exam or Royal College of Physicians exam, which are all online now, so you don't have to travel anywhere. If we go to Philippines, then we'll spend some time to go to San Lazaro Hospital, which is an infectious diseases hospital in a highly densely populated area in Manila, downtown Manila, and they see high numbers of tropical infectious diseases, such as listed here: dengue, TB, leptospirosis, rabies, HIV, tetanus, typhoid, diphtheria, meningococcemia, and they respond to big outbreaks of disease, such as measles outbreaks. And this is 2 years ago, 3 years, well, 2019. We spent some time in Manila, lectures, ward rounds, urban health, and we spent some time in Leyte Island learning about disease like schistosomiasis, collecting snails in the life cycle of schisto, and that was a very good experience. And it was a mixture of students from the course, plus 4 doctors came from NEC and NICA, some Filipino doctors, a really nice mix, a really good 2-week experience. This year we had more than 90 lecturers from 17 countries on the DTM&H, almost half is Japanese. It's very much Japanese course, but it mixed with very wide range of other lecturers, and they're listed here, but many of them are experts in the field of tropical medicine in the various areas they work in. David Worrell from UK, Matthew Burton, Robin Bailey, and many more. So the DTM&H course is for medical doctors with some 2 years experience, and can be quite a nice introduction to studying again, and can be sort of lead on to master's courses, PhDs, or very useful for doctors who want to work in international organizations, or also domestically in infectious disease departments, travel clinics. In UK, it's more or less mandatory for infectious diseases doctors to do Dtm&H course as part of their training. So their courses are very packed full of ID doctors in the UK. That's it. That's what I talk about Dtm&H and MTM courses. That's okay for the timings. よろしくお願いします. Thank you very much, everybody. Nice to meet you. Thank you, Masui Sensei.
Okay, thank you very much, Dr. Chris. それ